I have a friend here who was suffering from a very aggressive prostate cancer. He was very young. He was in his late 40s. And he had a history of it in his family, but he had never had a PSA test or any screening because he felt he was just too young. By the time he turned 50, he had passed away in New York. And I thought at that time I should look into my own situation. And he did a digital exam and said he felt something suspicious and recommended an MRI. The MRI indicated that there was what they call suspicious area about the size of a dime, and that I should have what is called a targeted biopsy, which means what's targeted, they know where they're going to look, and that was Dr. Yu who was going to do it, and that took place on October 19th, 2016. The results of that was that there was cancer, and it had spread, I guess, this is where I'm not clear on all the right words, but outside the capsule, which was indicating to me that surgery might be the best course of action for me. You receive pre-op instructions, post-op instructions, and release instructions. Not only should you read it once, you should read it twice, and the next day read it again. Most of the questions, if not all, that you have are there. You just can't absorb it, or I couldn't absorb it on one reading. And so I encourage everybody to read every piece of paper that you receive. I also read some of the research papers that Dr. Yu and his colleagues had written. Very technical, very medical, but you get some information from them. After getting on the table in the operating suite, I remember nothing. I do know that when I woke up, my wife was there, and a nurse was there and stayed with me for probably an hour during the recovery. And then I was taken to my room, which was quite large and quite very nice. I was very complimented that when I went home, I got a phone call from the actual person who took me to my room. It wasn't somebody that just calling from the office as a checkup. It was somebody that actually knew me. And then I remembered.